Are we on? Hey.
I just need to put this in the box real quick.
Oh, go ahead.
Sorry.
Yeah, no problem. How you doing? Hey y'all, what's going on? So it's midwifery week, and I just wanted to give you all a little tour of the office. Just a little backstory. I actually started my practice as a mobile practice, so I was definitely rolling around in the streets, conducting everyone's prenatal visits and everything. Like, my office was in the car, basically, and I was just in these streets. Okay, so I quickly grew out of that model of care. You know, that just was not something that I could continue as I grew my practice. So I eventually moved into my home after being mobile, and then from my home to an office space here in Tyrone, Georgia. So I stumbled upon this office space maybe about 5 years ago. I just love my office. I love my community that I'm in, and I was really afraid that moms would not drive way down here for service. So that was one thing, but one of my girlfriends was like, if you build it, they will come. So I'm passing that along to you all as some words of wisdom. Like, if you build it, they will come. Okay, so here's a little tour of my office in Tyrone, Georgia. It's a small and intimate practice, and that's what I love about it. I think I got into my head that if I was going to have an office, that it would have to look a certain way and be a certain size and be all these things. And you know, it doesn't have to be that to be impactful and to be valuable to, you know, the moms that you're servicing. So come on in. All right, so this is our little foyer, okay, and it's a family-friendly space. Families can come in with their children, the grandparents can come in to see what things look like when they're, you know, their daughter says they're going to have a home birth. You know, I always like everyone to come in and experience the prenatal visit, because, you know, just so they can see and touch and feel and understand, you know, how we're doing things here, and then they immediately feel comfortable. I did a lot to try to have an environment that is welcoming and warm and cozy, right? This is what I want moms to feel when they come into my office. This is the space they come in. There's no line, no wait. Okay, that is not what we're doing here. But come on in and I'll show you through. All right, so basically I have 3 exam rooms. I'm here 2 days a week. Okay, so that's just a little tidbit. When you start your own practice or have your own practice, you can work your schedule how you need to. So I'm here 2 days a week doing office visits. First visit starting no earlier than 9:30. Preferably 10 a.m. You know, I'm a princess now, okay? I am on princess time, all right? So one of my rooms I am using as our media room, and this is where I like to do some more, you know, videos and just educational pieces and bringing content to you guys, you know? So I have used this space for that purpose. So that is my room. Then I have my favorite exam room. This is pretty much the room that we do most of our prenatal visits and things. So it's funny because routine prenatal visits happen in here, but if you're coming in here at 40, 41, 42 weeks, you're going in the other room, because we're going to do all the things to try to bring this baby. So this is another exam room that we have, and we also have a sonographer that comes in weekly to do scans for our clients. So that adds a nice touch of convenience, which is also a value to adds value to the service. And then we come back here to our clinical vital signs station here, which is where I conduct vitals. We kind of sit down and chat and do a brief overview of how mom is doing. We get vital signs. The bathroom is around this corner here, and then this here is our lounge area, I like to call it. It's a nice space for our postpartum moms to come in with their babies. It's a nice cozy space for breastfeeding. Consultations are also happening back here as well. You know, sometimes moms need a moment to just really like decompress or kick their feet up so that they can just take a moment, you know, get some feelings out. Sometimes couples come in here and they need to get some feelings out, and I'm just listening. So there's a lot of conversations that happen in this room as well. And a lot of naps, because I lay on this couch, okay, after my day or at lunchtime, and this is my favorite place to come and rest. So I feel like when you're creating your own space in midwifery, that is really important, is for you to also feel comfortable in your space. It needs to be a space that is also soothing for you, so that you can be the best midwife that you can be for your clients, okay? All right, and so then we have another part of our office, which I'm not gonna go into because it's a little messy, but this is like our admin side of the office, and another bathroom for the dads. So it's a cute, cozy space, and I love it, all right? And I want you to create this for yourselves in midwifery, in whatever service that you are going to open up. So that's a little tour of my office, and have